Good afternoon, everyone. It's wonderful to see so many familiar faces today on the line and to see some new faces as well. I'm Aubrey Davis. I'm the Regional Director of Development at Partners in Health based here in Chicago. And I've had the privilege of working at PIH for about 10 years now and have met many of you over the course of that time. I'm proud to say that our Chicago area supporters have been and continue to be one of PIH's most committed and most generous communities of donors. And I'd like to take this opportunity to thank you all for your unwavering generosity. Whether you are a newer donor or have been supporting us for years, and no matter what level you're giving at, each of you is so important to the work that we do. And so I just want to thank you. And I particularly want to say thank you for your support in 2020 and this year. It's been a really challenging and frankly frightening time for all of us. And you all have stood by us and shown incredible solidarity with Partners in Health and with the people we're serving around the world. So thank you, thank you. It's been about a year since PIH was invited by Governor Pritzker to support the Illinois Department of Public Health's COVID-19 response, and a lot has been accomplished since then. And since the last call like this that we did in August 2020, the work has really evolved and expanded in very exciting ways. And so today, we're going to hear more about that and what's in store for PIH in Chicago going forward through a conversation with two of PIH's senior leadership on the Illinois team and one of our key partners here in the city. We'll begin with about 30 minutes of moderated Q&A, and then we're going to open it up for questions to you all. But as Heather said, this is a Zoom meeting. It's not a webinar, which means you can control your video and mic and participate in the conversation and chat. And so we really do encourage you all as part of this community to feel welcome to chime in with questions throughout the conversation. We'll be monitoring the chat, and you can also raise your hand and just unmute yourself and speak up. And last sort of business, I also just wanted to acknowledge a few people who are on the call today. We have one of our 3 local PIH trustees, Liz Cichelli, joining us today. Thank you, Liz. We're also joined by Partners in Health's Chief Development Officer, Andy Wilson. Thank you, Andy, for being here. And we're really honored and pleased to have Gayla Brockman, President and CEO of Michael Reese Health Trust, on the call with us today. And she's been one of our biggest champions and supporters here in Chicago. So thank you, Gayla. Now it's my privilege to introduce our 3 panelists today. We'll start with Dr. Evan Lyon. Evan has collaborated with Partners in Health for more than 20 years, beginning in 1997. He worked with PIH between Boston and Haiti for the next 13 years through graduation from Harvard Medical School in 2003 and completing his internal medicine residency at Brigham and Women's Hospital in Boston in 2007. In 2010, after about a year of helping lead PIH's response to the earthquake in Haiti, Evan returned to Chicago, and from 2011 until 2016 was on the faculty of the University of Chicago and serving the greater South Side through home visits for 2.5 years. He also served as the Chief Integrated Health Officer for Heartland Alliance Health here in Chicago. That was Chicago's healthcare for the homelessness organization. And for the first 9 months of the COVID-19 pandemic, Evan helped found and lead the Chicago Homelessness and Health Response Group for Equity. And in November of 2020, we were thrilled to welcome Evan formally back to the Partners in Health family, bringing his community health expertise from the mountains of Haiti and streets of Chicago to bear on serving the most marginalized populations in our city. He now serves as the Illinois Director for Partners in Health statewide collaborations with a focus on leading the Vaccine Corps partnership and establishing PIH's strategy for long-term work on equitable COVID recovery and reimagining public health in Chicago. So thank you, Evan, for being here. Our second panelist is Dr. Pranali Koradia. Pranali is an emergency medicine physician with a background in global health and health systems. Apart from seeing patients, she was actively involved in planning and managing the early COVID-19 response at Houston's main safety net hospital. Before becoming a physician, Pranali worked on health systems projects serving populations in low resource settings abroad and vulnerable populations in West Chicago. She completed her emergency medicine residency at Baylor College of Medicine after obtaining her medical degree from Rush University. She also holds a Master's of Science in Public Health from Johns Hopkins School of Public Health. Pranali is the senior project lead for PIH's Illinois team, leading our work with the Illinois Department of Public Health and the Cook County Department of Public Health. Thank you, Pranali, for being here. And our third panelist is Rachel Reichlin. Rachel is a registered nurse and is a senior program officer at Michael Reese Health Trust. Prior to joining the Michael Reese team, Rachel worked for Cook County Health's Medicaid managed care organization, County Care. Her career as a nurse ranges from providing acute bedside care on an adult medicine and infectious disease unit to community nursing as a perinatal nurse care manager and community-based researcher in Latinx and immigrant communities in Chicago, the Dominican Republic, and Israel. Rachel's drive to address health inequities and promote social justice led her to jointly launch Michael Reese's incubation program in early 2020 to take risks on new and experimental ideas. In addition to leading incubation efforts, Rachel works with their grantee partners in their homelessness, healthcare workforce, oral health, and hospital-based violence prevention priorities. Rachel holds a master's in nursing and a master's in public health. In 2016, she was named as one of 40 under 40 nurse leaders by the Illinois Nursing Foundation, and in 2020 was named a Terrence Keenan Institute Fellow. Rachel is one of PIH's key partners in our work here in Chicago and the architect of the Vaccine Corps partnership that we'll tell you more about today. Rachel, thank you so much for joining us. So let's dive in and start with our panelists by discussing how PIH ended up working in Illinois. Not long after COVID-19 hit the US in March 2020, Partners in Health partnered with the Commonwealth of Massachusetts to launch a statewide contact tracing and social support program. And it didn't take long for other state and city officials around the country to begin asking for PIH's help. So Evan and Pranali, could you share with us a little bit of the background of why we started working in Illinois in particular, and what have we accomplished so far?
Yeah, thanks. I'll speak quick and then pass it over to Pranali, who's running that work now. But very early, as the work in Massachusetts was just really kicking out, the governor's office and the Illinois Department of Public Health reached out and asked to build a world-class contact tracing program. A couple of PIH folks, including, I like to brag on, some folks who had done Ebola response in West Africa, came inside and behind Illinois Department of Public Health and were part of every action to build up the contact tracing. We continue work in collaboration with them, and I'll let Pranali explain in a little more detail, but starting in October, we also began collaboration with the Cook County Department of Public Health. The city has a Department of Public Health, the county has another, and a great hospital system. And so with the county, we also worked on contact tracing, the plans to deliver vaccine more equitably. And Pranali, why don't you kind of give us an overview of what we've been up to and accomplished. And I think we'll return to the kind of current state and future, but maybe help people get caught up a little bit.
Yeah, sure. Hi, everyone. Nice to meet you. So like Evan was saying, we started out working with Illinois Department of Public Health on contact tracing. And so a lot of what we do is what we did in the beginning was set up the contact tracing, but then also work on opportunities to make sure that we're giving people an opportunity to quarantine in a more equitable fashion. So we want to make sure, the whole point of contact tracing is you tell people that they're positive, like for COVID, and they need to stay home. And then you call all the people that are like potentially exposed to this person and let them know that they're potentially having COVID and they may need to quarantine. But then at the end of that, the actual quarantine is very difficult. I don't know if anyone here has ever tried to stay in a room for, days at a time, or their small home for days at a time. It is very difficult. And so throughout the process, it was just setting up the structure at first. And we worked very closely with our partners at Department of Public Health to set it up. And then at the end, like also trying to do what we call care resource coordination. And care resource coordination is kind of the crux there, where it's like, yes, we call people, we let them know they're positive, we tell them to quarantine, but then how can we help them quarantine? And so a lot of our work with Illinois Department of Public Health has been moving our contact tracing into, helping and support people and making sure that they get through, their diagnosis and their condition as supported as possible. So now we're working on, if you have a food request, like you don't have food at home and you're told to quarantine, if you need supplies for your baby, but you were told to quarantine, how can we help? And so we've really supported IDPH and thinking through that and making sure that we're supporting the community. And we're continuing to make that contact tracing structure equitable and stronger over time. And then through Cook County, as Evan said, we started in contact tracing as well. The local health departments, such as Cook County, also have a part to play in that, as well as care resource, and reimagining how they're giving resources to people in their community. And then vaccinations. And so vaccinations started much later, December, January. And that is in itself, has exposed all the opportunities that we need to meet to become more equitable in how we are vaccinating people. And you'll hear through our work at the VCP how we've been working with people on the ground to understand what needs to happen, what the barriers are. And at Cook County, where we accompany the government, we're able to form that bridge and kind of bring these learnings, the things that we've seen happen across the nation and the jurisdictions we work in, as well as in Chicago, as well as from our Illinois contacts, on how to get to that equitable vaccination. So we've been helping put together the mobile vaccine unit. We help put that together. Figure out how we can use data to get to the most vulnerable areas and what needs to go into that, which factors need to go into that. That's not only income, that's also, race, ethnicity, that's historical concerns, vaccine confidence. There's so many things that we've been trying to impart, and we have been able to impart to our county colleagues that has really helped advance our work in equitable vaccination.
Awesome, thank you. So that brings us to today and the Vaccine Corps partnership work that Evan mentioned briefly. So Evan and Rachel, I would love it if you could sort of help explain how the Vaccine Corps partnership came to be and how Partners in Health got involved, and then what are you doing and what are the things that you're doing as part of the Vaccine Corps partnership?
I'll jump in again quick, but want Rachel to tell the story because a lot of this was really her vision and idea and the capacity that Michael Reese and now the Health First Collaborative has been building. But here in the city of Chicago, we took on the project management of the Vaccine Corps partnership beginning in early this year in January, essentially, and have built a collaborative place where people come to share information, hear directly from state and county or city and county around vaccination, and increasingly to highlight and support the work of community-based organizations. When we picked this up, it was largely healthcare thinking about this, but knowing that to get to some degree of equity, we had to have everybody and different people talking about vaccine and carrying the message forward. There needed to be some durability to this to work on creating jobs and building workforce around public health, given the moment. And then, of course, to work on equity in vaccine delivery. But Rachel, tell us how this came to be. You've given us this amazing chance and support to build a thing, to grow a thing, and I think we're doing it. So, but yes. I think the story is great for folks in the city to hear about this, funder, private sector, public sector, and then really community focused organizing.
Sure. Thanks so much. And thank you, Aubrey and Partners in Health, for inviting me to be part of this panel and really lift up our collective efforts and PIH's leadership in our region. So as a public health nurse trained in global health, I have long admired and learned from Partners in Health work. PIH is known to center community members life experiences and expertise. They really see their community partners and themselves as both teachers and learners. And I believe this is really key to their approach, which I find so necessary and critical in this time. So today I'm privileged to nurse communities and nurse systems through my role at Michael Reese Health Trust, which is a public foundation focusing explicitly on ensuring all Chicagoans can live healthy lives. While we've been grant making for over 20 years, as a newly public foundation, we can also incubate and advocate. And the Vaccine Corps partnership is really one of our incubation efforts. I want to touch briefly on how we're structured at Michael Reese, because I think it's part of the secret sauce, which helps us leverage all the breadth and depth of PIH as an organization. So as an incubator, we take on risks of new and experimental approaches to improve health and compare our evolving advocacy program to push for lasting change. So our incubation function allows us to respond quickly, strategically, and collectively as we share the risk of seeding adaptive solutions. We get really close to our incubation partners and leverage our pillar programs to have a transformational impact. And I'm sure Evan and Pranali can speak to that sort of proximity that we have with each other. Philanthropy is really good at moving quickly, while our government partners can go deep. So in the case of the Vaccine Corps partnership, PIH is really building this bridge. There are three components that help us be especially nimble. One is our deep relationships and expertise across our partners, both with regards to funders as well as grantees. Two is our expedited review process. And three is the flexibility that we have in our staffing to shift capacity to start a new effort. The Vaccine Corps partnership really benefited from the foundation we laid with the Health First Collaborative, one of our other incubation efforts. In early 2020, in response to the twin pandemics of systemic racism and COVID-19, a group of 5 funders pooled resources and formed the Health First Collaborative with the intention to support community-led demonstration pilots that can be replicated and or scaled to address the root causes of racial health inequities and ultimately improve physical, mental, and social well-being. The effort now has 16 participating foundations. Both public and private partners are at the table. We have 2 community advisory councils, one in English and one in Spanish. We have 2 hubs of community-led health transformation. Hub 1 focuses on community health centers, and Hub 2, the Vaccine Corps partnership, really centers community organizations supporting folks who are most impacted on the ground. Each hub has evaluation and policy and advocacy support baked into it right from the beginning to capture the iterative learnings. The Health First Collaborative formally launched in July and has raised over $5 million to date, with the majority of fundraising to date going to stand up a multi-year effort for Hub 1, as well as catalyze the Vaccine Corps partnership by bringing on PIH and getting money flowing into community. The Vaccine Corps partnership really got started in September, and our grantee partners at the University of Illinois Chicago raised the idea of scaling the work that they were doing with high school students as health promoters for the COVID-19 vaccine. Those initial conversations quickly moved to how we could coordinate efforts and trusted messengers at scale across our region, which ultimately evolved into the Vaccine Corps partnership as it is today. We helped the project take root by convening our partners, health providers, and several of our grantees in community, knowing full well, as Evan mentioned, we didn't have enough community members at the table. As interest and traction grew, the Health First Collaborative sought a project manager that could help build out the governance and infrastructure for communities to be centered and the emerging workforce to be supported. We engaged a unique project management team and partners in health. They bring a combination of technical assistance with respect to epidemics and an approach that included community organizing and a philosophy that really mirrored ours, which I'll speak to later today. In addition, they were already partnering with both the Illinois Department of Public Health and Cook County Department of Public Health on COVID mitigation efforts. So it really seemed like a powerful next step for us to engage them to have ultimately have a regional impact. This work is showing that health is everybody's business and we each have unique assets to contribute to healing and strengthening our communities. The gaps still persist. You're hearing about some of them in the news every day. And as I said earlier, philanthropy can move quickly, government can go deep. So the procurement process, for example, for public dollars, it's not simple. And while we wait for those dollars to start flowing, PIH is in community, making critical connections to help us extend our reach and better advocate for necessary public health infrastructure, including bolstering the workforce needed to really heal and thrive. Thanks. That's the start of vaccine partnership.
Thank you, Rachel. Yeah, Evan, did you have anything you wanted to add about the sort of day-to-day of the Vaccine Corps partnership work?
I guess so. And then would like to, actually would like Rachel to, continue a little bit about, well, let me rethink that. Yeah, the thing that the great things that have happened is there was a space created and we were given the chance to expand it. Turning the focus onto community innovation, smaller and smaller levels of innovation, helping support directly with these funder partners, the work that's going on. Some of it's that's not been visible to big funders like the city or some of the kind of large social service agencies in our region. Getting in, learning from those folks, investing in them, and then continuing that cycle. We're doing a lot of that in the county as well. In terms of impact, I think the biggest thing is that people come and we're creating partnerships across the table. 110, more than 110 organizations have come. Weekly meetings are at least 100 people, and 350 people total have kind of come through, made connections, move on. And maybe for question and answer around some of the ways that public policy has gotten toward equity plans and the way we've supported it, but the work in the city around the Protect Chicago Plus initiative to target 15 highly vulnerable neighborhoods and get vaccine to people more quickly was built off community roundtables. And we joined some of those, we kind of started some of those, solved scheduling problems, added tools for communication, got speakers out to do town halls, and just anything that was asked of those, adding energy and adding resources as we had them. And we're seeing some shift. There's a lot of ground to cover yet to get vaccine to more people and to get it out more equitably. But the efforts have really moved the needle on vaccine protection in some of our neighborhoods. And, I think we plan to kind of end on kind of future thought, but it's, the chance to support people who are doing community health work through contact tracing, through outreach, through promotoras that already exist, and new folks who are coming in, a youth ambassadors corps, interfaith youth initiative, and people who've been doing violence prevention outreach, but now do COVID prevention and vaccine outreach. That this incredibly rich community of folks who are now, like Rachel said, seeing that public health is everybody's business. We've been able to kind of pull more people in and keep deploying out to reach more people. And now we're at the precipice of some change in the city that should allow some of this to persist. It's been on our minds constantly that this crisis should get us to a place where public health is recognized again, supported, it grows. And if it just grew in the ways to where it was, we haven't done our best. And so thinking around kind of transformative potential.
Mm-hmm. Yeah.
What would you add, Rachel? I mean, you've been, one thing I'm just going to brag on Rachel a little bit. None of us, I think, have ever worked with funders in this way, right? I've been in the nonprofit world my entire career, except for excursions into academicness. But we work together on a granular level as very equal partners, and at least twice a week, often more, co-designing these things, building knowledge together. I think there's no way we could have moved with this speed. I've been in the city for 10 years. which, real Chicagoans would say is not that long, but, I've been making myself at home, and we're new, we're relatively new. And the fact that we've been able to gather momentum, we've been on the notice of the City Department of Public Health, of all the major academic institutions, a bunch of our community clinical partners, and then other partners. I think there was a hunger that Rachel and others recognized to have new space, for neutral space, right? Our dog is with the community, and our dog's with getting work done. And when we bring people together, there's a very clear tone set that, the community folks are going to talk first, and we're on an equal playing field, and diffusing that power in especially medicine and healthcare, it's a little trick. And I think that's been working, and that's going to help guide us on to the longer term stuff.
Yeah.
What would you add, Rachel? Yeah, or Aubrey?
Rachel, did you want to respond to that?
Go ahead, and if you were
Okay.
then you were going to say.
Sure. Yeah, I was gonna acknowledge the question in the chat from our friend Wendy Fox Lawson, because I think it's a really great question that leads into my next question. She wants to know, how has the PIH accompaniment model been used in Chicago? And Rachel, you alluded to this a little bit earlier, but maybe you can talk a little bit more about why you wanted Partners in Health to lead this project, and was accompaniment one of the values that you were seeking to bring to the Vaccine Corps partnership when you created it?
Yes, that's a great question. And I think, when I think of why Partners in Health was an ideal partner for this effort, I think it would come out accompaniment, is a key piece. Why Partner in Health's global work really translates well to this landscape where the scale of the response is so unprecedented and so uncharted. And when you think of like a global health response, what can they do locally when they typically work in much more under-resourced areas? Sometimes there are certain areas and neighborhoods in our local community here in the US that struggle in similar ways, and are similarly under-resourced, are grossly impacted. And that expertise of stepping outside of your norm, of typical ways of doing things is really some of the special assets of Partners in Health. So I knew that Partners in Health had that experience. I knew that Partners in Health had a brand and recognition that could really elevate and enhance and support whatever was emerging across the nation or the world to help benefit Chicago. And really there's three things with Partners in Health. It's their experience, their philosophy, which I said is very much aligned with ours, and their approach. And when I think about experience and think about project management for the Vaccine Corps partnership, there are not many project management consulting agencies that have experience and the technical assistance with respect to epidemics, and really liaising with government partners around a health epidemic. The philosophy was really similar and akin to ours. We believe, the Health First Collaborative funders believe in the resilience of communities and individuals closest to the challenges, and are committed to work in a way that supports their creative solutions and their leadership. And that philosophy of Partners in Health accompanying community members in that way was really first and foremost for us. And lastly, their approach. They know what it takes to improve health. They know it takes access to specific services, and they have clinical judgment to help prioritize what's needed first. They know it requires a deep level of community engagement and trust, and value the expertise of community organizing on their team to do this, really effectively. They have members of their staff, Partners in Health does, that have expertise in campaigns, in community organizing, not just clinical expertise and not simply an MPH. That extra talent is really invaluable in our local landscape right now. And lastly, they know it's not easy to improve health. They are gritty, they're persistent, they're gracious, because they know that health is possible and they're going to find a way. So all of those pieces made Partners in Health really a ripe candidate for this work.
Aubrey, if you don't mind if I can add to that.
Please, yeah.
I mean, accompaniment, I think that is like such a wonderful question. And I think Rachel said it best. The Vaccine Corps partnership, I will say VCP, they accompany the community, right? And so accompaniment, the way we see it is, or when we talk about accompaniment, it's walking side by side with our partners. And so in Chicago, that's what we do. We walk side by side with our partners, including the community. And at Cook County, it's the government that we walk side by side with. And it is very interesting. Illinois is very special because we have the community accompaniment, as well as the government accompaniment, as well as the state accompaniment. So what we're doing at IDPH, Illinois Department of Public Health, and Cook County Department of Health is, again, meeting people where they are, knowing what the government can do and seeing how we can seize those opportunities. It's not consultants that come and say, these are the 10 things that have to happen today, and because you have to know what is possible and where you can bridge those gaps. And so I think that's like so important. We are able in this environment to accompany the community and the government at the same time and work together, which is great.
Yeah, I love that. I'm wondering if you all can sort of make this real for everyone. So, I think we have a sense of the way that the Vaccine Corps partnership and Partners in Health work is bringing people together. But what is the impact of that? What does that look like on the ground for local CBO, local community-based organizations, and then the communities that they're trying to reach and that they're serving?
Yeah, I'll give two quick examples. With the efforts to get vaccine out quickly to communities based on where they are, and during a time when we were in phases and 1B was kind of the limitation, the city dedicated vaccine doses to 15 neighborhoods for anyone who lived in that zip code. But you got to get people to know what's going on, answer questions, engage, and be in conversation, and then ultimately help people, get to the vaccine. And in one of our neighborhoods, Englewood on the south side, the day that the vaccine became available, we got into a process of planning and realized quickly that scheduling was going to be tricky, and the community partners said they wanted to control it. They needed to have control over scheduling so they could reach their call list, their close people one by one, and help them get signed up for these vaccines. And that built into a little tool that was that helped people get vaccinated. It was expanded to 2 other neighborhoods. And, to date, more than 7,000 people have been scheduled and brought into vaccination just by that tool. But the aspect that it's controlled by community is part of why it works. Larger, chunks of vaccine availability through the United Center and some other mass vac sites. Often communities can't really help people navigate towards something that large, but when it's under their guidance, then we can adapt the form to each little group and have customization, and it seems to be really working. And it was developed in back and forth consultation with non-medical people, with the community-based organizations who we knew folks. Related, again, from that roundtable work and accompaniment to these community processes, in back of the yards, there's a really dynamic community organization called Increase the Peace that's been training and deploying, giving jobs to young people to be in the work of preventing violence, interpersonal violence, gun violence. And leader from that group said, if I could just get a little more money for a little more of these people's time, they can become vaccine ambassadors. Like, we know where to talk and who to talk to. And so, Zoom, we were able to move some resources. That that neighborhood over the 6 weeks of the Protect Chicago Plus plan brought over 95, they filled over 95% of the vaccine appointments. And I think it's the highest single, kind of fill rate that I know of. And a lot of it was those young folks. A lot of it was young folks taking the message one by one to the guy in the corner, to the laundry, to the, anyone who might listen. They had this existing skill of engagement, but had not worked on health. And so, kind of finding those little opportunities and investing in them, I think that's kind of the satisfying work as a person, meeting these folks and learning from them.
Rachel, how about you?
Yeah, I'll just add on from the funding perspective. One of the things that we've been able to develop just recently, and we're still fine tuning, is a expedited process or a way in which Partners in Health can sort of vet some of these really small hyper-local organizations and find out what it is that they need in the next 2 to 3 months to support their community to access vaccine. And then what are the resources that they need to help move that quickly, whether it's funding, whether it's connectivity to a speakers bureau or a town hall or flyers or communication materials. Partners in Health is doing the vetting. They're bringing it to the funding table. The funding table is working across a variety of pooled funds in the community area, in the Chicagoland area, to identify how to move those dollars quickly. And in the past 2 weeks, we've made 8 small grants, totaling $110,000. So in 2 weeks, that's pretty fast in philanthropy time, or regardless, to get into the community to those that need it most.
Great. And Pranali, I wonder if you could speak a little bit to the impact of the Vaccine Corps partnership for your government partners that you're working with in Cook County and Illinois Department of Public Health.
Yeah, definitely. Even if we talk about like the way vaccine gets out, there's a local health department in Chicago that's specifically for Chicago. And then you have the Cook County Health Department, which is for basically suburbia around Chicago. However, if you look at any map, there's no border, right? Like South Chicago has South suburb. Chicago looks exactly like West Suburban and Cook County. Same for the North. And so there is no border. The demographics are saying the problems are the same. And while our impact at Cook County has been really great because of the Vaccine Corps partnership, we have had our partners participate in the Vaccine Corps partnership meetings, which are every week. And I was actually talking about this before we started today, but it really helps our government partners get close to the community and like really feel what the community is feeling. It really has given them a chance to answer questions directly, explain what the barriers are that sometimes people just need to know, like, why is this taking longer? Or what can we do to make it go faster? And so I think that's one thing, is the communication and the bridge we've made, but also as the team lead for Cook County and IDPH have gone to be like seeing Vaccine Corps partnership and what they do, I've been able to bring those learnings to the government to say, listen, like, when the Vaccine Corps partnership is doing this, like, this is what's happening. This is what the community is saying. These are the resources that are available. And how can we bring it to the rest of Cook County, which is like the suburbs? Because again, the barriers that people are facing in South Chicago are the same as in South Suburban Cook County. And so we're able to leverage that partnership on so many levels. One example is the Speakers Bureau, which Rachel was alluding to. Like, when you want to have town halls, if you want to get, doctors out to talk to people and just explain to them, like what is the difference between Moderna and Pfizer? Like, why are people saying that this is happening too fast? Or, what's going to happen like the day after I take my vaccine? Making VCP, Vaccine Corps Partnerships, Speakers Bureau, it was so easy to bring that to the rest of Cook County. And that's just one of the many tools that we've had that have helped us reach so many people, not only in the city, but right outside the city as well.
That's great. Thank you. I want to address a question from Aisha in the chat. She is asking about the organization My Block, My Hood, My City, which I think a lot of us have come to know over the last year or so, and curious if that organization is one of the CBOs that we're working with. Oh, Gayla, did you want to respond?
I can actually answer part of that. I don't know if Evan has additional answer. I actually work for them and have told them about this opportunity to make this connection. They have a very robust network, so they haven't taken me up on it, but they certainly know about it. So I don't know, Evan, if you've talked to them.
We have not yet. You know, we need to keep inviting them. We've worked with a number of organizations like the violence prevention thing, which, you know, overlaps with My Block, My Hood, My City, and have learned a boat ton. But I don't think we've sparked up a good collaboration there. So
they have their own lists of outreach, focusing primarily on seniors,
right.
Which that's what I do is we reach out to get seniors to their appointments, setting up the appointments, identifying who's homebound, and then driving them to and from the vaccination appointments. But seniors can be broadly defined when you're outreaching to an area code that the Protect Chicago is in. So they have these massive lists in their database of people, and that's what they've been doing. So they don't really need, at least at this point,
They don't need a network. I know. Yeah. Just as for everyone to know in the region, the ability to get a vaccine to a homebound person has turned a corner in the last couple of weeks, and both city and county are close to real time. Within some days, if you know a homebound person, disabled, even just people with agoraphobia and whatever limit that might make a hardship getting out, city and the county can get someone out with a vaccine rather quickly. And we, you know, if we can help connect with one of your neighbors or someone in need, please let us know.
Yeah, great. Thank you. And just a reminder to everyone, if you'd like to ask a question, please don't wait till the Q&A. Go ahead and drop it in the chat or raise your hand. So the last question I want to end with before we open it up is thinking about the future. Because I think everyone is ready to think about the future, right? Vaccines are rolling out. People are feeling like they're getting back some of the normalcy of their lives. And so I'd love to hear each of you speak about what do you think long-term systemic change looks like in Chicago's health system? And, you know, in that context, what is your vision for the future of the Vaccine Corps partnership and Partners in Health's work in Illinois and Chicago?
I'm going to jump on first. You know, I think we can and should stay. I think there's a lot of work that needs to be done in this region. And the way we've been thinking of it is in three big channels. There's the work of the Vaccine Corps partnership, driving collaboration, innovating collaboration, and ultimately highlighting the voice of communities and getting to a place where that's part of public health. And so that kind of infrastructure or systems change, it's one of the S's from Partners in Health. And I think we have a chance to be influential on systems. Topic for another update, but part of all of this is training. And so training, you know, quick and then deeper and onward to a new kind of public health work or a new kind of community health work. And we're really on the cusp of declaring what we're calling for now the Health Justice School, thinking about democratic traditions, the freedom schools, and organizing the future of public health through organizing the skills of how do you meet people, how do you talk, how do you engage and convince, how do you run a meeting, how do you collect data from out in your world and amplify that to keep moving. And then, you know, the public health side, you know, no shade on my tribe, but the public health stuff is easy compared to engaging, right? And so when it's time to learn about a vaccine, great, or diabetes, great, we can do that. But, you know, thinking about a new set of skills and a new learning community through the school. And then, you know, if Partners in Health is going to succeed here and be true to what we've all learned and been a part of, we've got to be in the work of hands-on care and hands-on accompaniment. And so, thinking about moving beyond health care, which has its good and has its limits, to centering public health and centering community, and thinking about community health work in a way that's almost an inversion from what much of PIH has done across the world. Half of PIH's staff, more than half of PIH's staff, is community health workers across all the countries where we work. In Haiti, it's always been right about half. And in that system, community work comes from in a place of need, connecting with community health from a system down to communities and back up. It's a more vertical kind of intervention. But if you think of the health needs of a poor person, say on the south side of Chicago, they're surrounded by systems, but they're all busted and fragmented and might be good for one thing or not another. And so a community-based community health worker that could be agnostic to where people get care, but just assuring that it's good care. I think we can get to innovating on that model with a community-based community health work that can go across the spectrum to wherever quality is. And the last thing I want to say, we were having this conversation 10 days ago that these ideas about community centering and moving anchor for priority setting, information, innovation, hands-on community navigation work would have been fairly theoretical. But the city of Chicago has announced a really ambitious 5-year effort to build health equity zones, 6 zones across the city. There'll be a hub for each one. All 77 of the communities will have a lead community organization, trying to hold on to some of what we've learned through the community roundtable work. And Partners in Health is invited to help think about what are the goals and the data, the metrics that we want to be a part of with our partners from Sinai, the Sinai Urban Health Institute. And we'll have some part in basically making the VCP a citywide effort and over more time, so that we'll get through COVID, but start to think about the other things that kill people, cardiometabolic disease and cancer disparities, addiction and overdose deaths, mental health. And so it's an exciting moment. The city is investing in this infrastructure that, if it's done right, can transform the way that public health is understood, the way that priorities are set. So I really hope that's the work we're going to be with for the next bunch of years.
Really exciting, Evan. Thank you. Pranali or Rachel, you want to talk about the future?
I'll just compliment what Evan said. I think Evan really laid it out really well. I'll just compliment by just showing what that really looks like. So when Partners in Health started in Illinois, they didn't have a formal relationship or engagement with Chicago Department of Public Health. And they are now sitting at the command center, the vaccine operations center of the Chicago Department of Public Health on the top floor of the Harold Washington Library. They are enmeshed, they're accompanying, they are collaborating, they are valued and respected for the community mobilization work that they are doing. And they are seen as an essential partner. They don't know exactly what that partnership looks like yet, but they know that they have this opportunity to do more with Partners in Health as they stand up these health equity zones in the current RFP. Like I said, the government can go deep. They're not there yet. It's going to take some time in order to, get the money starting to roll to the regional leads and the community leads of the health equity zones. But we're already starting that right now as the VCP really takes hold, and they're seeing value in Partners in Health's strategic community organizing efforts. So that is the bridge that they're serving right now to that future that Evan so well articulated.
Thank you, Rachel. That's great. Pranali, anything to add?
Yeah, I mean, I guess for me, like fortunate to also see the other side of it, where it's, how do you bring the government side closer to the community, of the community being elevated? And I think that's the beautiful nature of this, is as we get Chicago DPH involved, and we're advocating through them, and then right next to them, Cook County, where, Chicago Heights is, and Harvey is, and all of these places that require more attention and more access. It's how do we bring them closer together? And I think that you need both sides, as Rachel's mentioning, to make those changes, transformative changes. And that's something where we've established friendships and relationships and accompaniment to make it happen. And Chicago DPH, Cook County DPH, Illinois, they talk to each other and they look for best practices from one another. And I think we just have a chance to grow and improve our state, our city, and our state. So.
Awesome. Well, thank you. I know we are drawing close to time, so I want to open it up for any further questions from the group. Feel free to drop them in the chat, or just go ahead and go off mute and ask your question.
Am I off mute?
Yep. Hi, Linda.
Hi. This has been really great. Evan and the rest of the team, can you just describe in a little more detail how you are working with communities, and give us an idea? Is it Back of the Yards? Is it Englewood? Is it Auburn Gresham? Is it South Chicago? Is it all the South and West Side? I hear you that there are a number of groups that are involved. I actually would also say, if you can get My Block, My Hood, My City involved, they really do have a very, very strong network. But just give us some real granular examples of how it works. If I were asked to describe what Partners in Health is doing in Chicago right now, I think, Rachel, you all have given us a fantastic background. But if I were talking to try and get someone interested, even in giving money or whatever, how would I describe all of this super impactful work that you're doing?
Yeah. Linda, thanks for the great question. It's a challenge. We're doing systems change work, which is harder to punchline, right? It's harder to punchline than, say, a school and this many people trained, or community health work that's and focused on a certain thing. In fact, what we're doing is creating a new and open space with heavy community investment to create the chance for equity across the city in the places that need it, Black and brown communities. So more South and West, although we've been partnered to groups further on the north, especially the Northwest side, and kind of anywhere. But the interventions so far has been creating new space and driving collaboration through organizing and bringing people together on the like actual ground, actual work, kind of person to person, shoulder to shoulder. We have a roster of about 50 people who will go out on invitation to go and speak about vaccine, and with a heavy focus on Black and Latinx providers, Spanish-speaking providers, a couple other languages. And so as there's a chance to dialogue, we can send somebody out, and we've got them all set up to run a good meeting and be in that kind of conversation. The roundtable work, we've been part of as the city through Protect Chicago Plus, and moving, Englewood to Back of the Yards to Humboldt Park and Roseland. In the county, that work is needed as well. So we set up and convene separate meetings for community leaders, come in, share their hurts, share their ideas, connect them to resources, and move in an ongoing way, because the true fact is that vaccine's not getting to people, and it's just gotten harder, right? The folks who really wanted it, many have been able to get it, thankfully, and places where, documentation status or other, specific vulnerabilities, or just no connection to healthcare, we have to keep going closer and closer and closer. And so it's not as punchline of work, but having a having a weekly meeting with 7, 8, 10 leaders in the west suburbs to talk about exactly what their municipality needs in terms of vaccine, and then getting those resources and bringing them in. That's been most of the work. We are training some people. We're certainly, in dialogue around these kind of policy stuff with the city, but it's organizing work, bringing people together, setting a tone where people actually work together, and then building, kind of bridge after bridge. Is there a punchier way to say it, Rachel? It is. It's system level work, and so it's not.
Well, I would add, one example would be, so for Cook County again, VCP has been able to work, through Chicago, but also bring their teachings and their learning, outside of it. And so one thing is this roundtable, and which I think is so integral now to what we're doing across the table, is making the community at the center. So elevator speech wise, I guess it would be like convening people, convening partners and community partners together to help empower them to talk about how they want their public health to be done, so it's convening people, community members in the West Side to come together and decide hey, if we help you get vaccine, if we talk to the government and say, we will get you vaccine, whenever you need it, can you guys you decide when you want it, where you want it, how you want it, and kind of empowering everyone in that area to make these decisions together. And then because of our relationships, we can go to the government and be we have this community, this hyper local area that's ready to put on vaccines. Can you help us get vaccine there? And then make it happen. And so I think that's one of the really great ways of using our accompaniment to say, we have been able to accompany the community, and this is what they want. And we are accompanying you and telling you this is what they want. How can we make it happen? And working with our partners to make it happen. So mobile vaccine unit is just one example of how we've been able to kind of partner and use the VCP's members to come together.
Mm-hmm.
That's great. And Evan, I think your example, I think it was you, Evan, that or maybe Rachel, about the example of, pulling people together to get out the community. I can't remember which community group you were talking about that you got that went out and you gave the numbers. That's really great.
Yep.
I mean, I'll think about that. And, Aubrey, if you can give us a little bit of that, because that's the stuff when you say to people, this group, I mean, Pierre, what you were saying about convening and pulling people together, et cetera. But that's if we can give numbers of this group actually went out and got X number of people vaccinated, working at a community level, it's helpful. It's helpful.
Yeah. To that May Day, the Mexican consulate, our team supported 250 new people getting vaccinated at the consulate. And That's important because it's a place that Mexican American and some undocumented people know they can go, right? Mm-hmm. And so the vaccine got there, and it was our schedule and stuff. And I caught up with it's a group called Illinois Unidos, caught up with them this week, and they're now teaching another community organization how they use that tool. And so the, do one, learn one, do one, teach one. It's advancing some on its own. And I think we'll see that in numbers as we go. Yep.
Yeah, and I see that Gayla is putting some information about the Vaccine Corps partnership in the chat, which brings me to sort of closing us out and sharing where you can find more information. My colleague is going to I think she has put a link to learn more about the Vaccine Corps partnership at their landing page. And there's actually a new website forthcoming this month that will provide even greater information and impact information, et cetera. You can also learn more about Partners in Health's COVID-19 response and specifically about some of the work in Chicago at the link that's in the chat. I'd also just encourage you all to make sure you're signed up for Partners in Health's mailing list, follow us on social media, like us, share us, and help spread the word around Chicago like Linda's going to be doing. And so that brings me to the end of our event. I really want to thank everyone for being here. I want to thank our panelists, Evan, Rachel, and Pranali. And I just want to close out by saying thank you to each of you who's joined us, who's supporting this work, who has been a supporter and has been faithful and stood by us through this pandemic. And I hope to see you again in person sometime soon. But until then, take care and have a wonderful evening. Thank you.